Hi guys, we are going to discuss about distal fracture of radius. We have two types of distal fracture of radius. First one is a Smith fracture and second one is a Colles fracture. We will discuss them one by one. So first lecture is about a Colles fracture. So what is Colles fracture? It is a reduction fracture of distal end of radius. In this type of fracture, the distal fragment is displaced dorsally. If it is displaced palmally, then it will be a Smith fracture, and in case of Colles fracture, the distal fragment of the radius will be displaced dorsally. Okay, so here we have two surfaces of hand. First one is a palmar surface and that one is a dorsal surface. Okay, so it occurs with Diner-Foch deformity. What is Diner-Foch deformity? In this kind of deformity, the hand has Diner-Foch like shape. As you can see in this picture, the hand has Diner-Foch like shape or configuration. So we can say that it occurs with Diner-Foch deformity. Now we will discuss about the mechanism how the Colles fracture is happened. So here we have a mechanism. In Colles fracture, the ulnar styloid process is avulsed and move distally as compared to the radial styloid process, and the distal fragment of radius overrides the rest of the bone dorsally. You can see in a lateral view the distal fragment of radius overrides dorsally as compared to the palmar surface. If it is displaced palmally, then it will be a Smith fracture, but in Colles fracture the fractured bone is displaced dorsally. Okay, so we have different histories when a patient is presented in emergency. First one is a falling on outstretched hand. We can say it forced extension of hand can cause Colles fracture. Forced extension of hand or falling on outstretched hand can lead through the Colles fracture. So slipping and tripping are and other histories of Colles fracture. So it is basically outward fracture of distal end of radius. So we have two complications about Colles fracture. First one is a carpal tunnel syndrome and second one is a rupture of extensor pollicis longus muscle. So these two complications are associated with Colles fracture, guys. So treatment are usually use CAS, and you can also use splinters. These are two treatments of Colles fracture. So that was our today's lecture. If you enjoyed it, please like and subscribe my channel and stay tuned with us for further videos. Thank you.